Acute versus Chronic Illness by Dr. Sparks, ND. Do you know the difference between acute and chronic illness? Most people don't. As Dr. Lindlar said, both begin with a violation of nature's laws in diet and lifestyle. But there are some differences too. An acute illness usually lasts less than 6 weeks, and the body is able to fully recover from it, or dies trying. A chronic illness lasts longer than 6 weeks, and the body is not able to recover without the use of outside supportive interventions. Acute illness is the result of a weakened terrain that a pathogen can penetrate and cause disease. When we violate nature's laws repeatedly, we begin to build up morbid matter that eventually changes the composition of our blood and slows elimination pathways. When the body finally breaks down, the germs take hold. The immune system responds and creates acute symptoms like a fever, and then the body begins to heal itself. Part of this healing includes what we call a discharge that has a cleansing effect on the body. This can be in the form of emotions, sweat, mucus, vomit, or diarrhea. If the acute illness is treated properly, the host survives and is actually healthier after the illness due to the discharge effect. Chronic illness can come from genetic issues triggered by lifestyle factors, toxic burdens, or nutrient deficiencies, or it is the result of an improperly treated acute disease that lingered. This typically occurs when we suppress our symptoms with medications, for example, steroids. When we suppress symptoms during acute illness, the germ can go into a state we call latency. It can emerge later when the body's terrain gets weaker. When the chronic disease happens, it's because the body can no longer adapt to the stressors that have been inflicted upon it. It can no longer heal itself without help. In order for the body to be able to truly heal from a chronic disease, the right conditions need to be restored first. This means that the following need to be addressed: a healthy diet and lifestyle, proper elimination and detoxification, physical structural issues, and yes, even stress management. After these are established, outside interventions can be helpful. These include herbal medicine, acupuncture, homeopathy, hydrotherapy, mind-body therapy, and other natural supportive alternatives. It is at this point that the body can mount a healing response to actually restore the health of the patient. This is called a healing crisis. This is where the chronic illness turns into an acute condition to heal itself. So there is hope to heal instead of just managing a chronic illness. Watch my video about the healing crisis to learn more about healing in this way. Don't forget to like, follow, and please share with like-minded folks.